We are going to start. A couple of people are here. Good. And somebody asked for a session on hepatitis B and C and as well as malaria. Today we are going to see only hepatitis B because we have only enough time for that. And then after that, tomorrow we will be seeing hepatitis C, and tomorrow, day after, maybe we will be, yeah, somebody raise the hand. Yeah, please let me know in the chat. Okay. All right. We will go ahead with hepatitis B for today. Okay. First thing, how to approach hepatitis B and C virus infection. Today, we are exclusively discussing on hepatitis B. All right. Then after that, we can go for hepatitis C. Okay. iPhone raised hand. Yeah, please, doctor. Can you please ask your query in the chat? I'll be more than happy to answer your queries if you have anything else. Okay. Now coming to the virus per se. Thank you, doctor. Now coming to the virus per se, hepatitis B virus. This is an enveloped, non-cytopathic, hepatotrophic, highly infectious DNA virus. Okay, I will tell you where and all the MCQs has been asked so far. The first thing they had asked about hepatitis B, whether it's an enveloped or a non-enveloped virus. This question has been asked in this clinical, I mean, like your basic sciences, I'm sorry, the basic sciences questions. Then they asked about whether it's a DNA virus or an RNA virus. Make sure, very, very clear, this is a DNA virus. All right, this is a DNA virus. The outer envelope of the virus contains 3 surface antigens. Of that, the most abundant and the most interesting antigen for us is S protein. All right, be very clear, it's S protein. The development of cellular and humoral immunity to HBsAg is protective. All right, it is protective. This is the virus. All right, this is the E antigen here. This is the DNA of the virus. It has a lipid bilayer membrane. Okay, there is a DNA polymerase here. And this is the large surface protein, that is HBsAg. HBsAg can be large, medium size, and as well as, small size, HBsAg can be there. All right. This is the picture, overall picture of a hepatitis B, and this is core antigen, HBcAg. And this is E antigen, HBeAg. This is the structure of the hepatitis B virus. All right. Make sure no one has any doubt in this. This is the basics. This is the microbiology of it. Coming to the genotypes. All right. Genotypes. This again has been asked in MCQs across various formats for MRCP, PLAB, and so many things. Even in the Viva, they had asked once, like, and how and which genotype is more infectious. Genotype A is mainly found in US and as well as Northwestern Europe. And genotype A is associated with a higher rate of HBeAg conversion with interferon therapy compared with genotype B, C, and D. This is an MCQ. Be very careful. Once again, I'm telling there are a lot of genotypes starting from A to I, but the genotype A has a higher rate of HBeAg seroconversion with interferon therapy compared to B, C, D. All right. Be very, very clear. All right. Be very, very clear. Okay. Next, genotype B and C mainly found in Southeast Asia. B is associated with earlier age of HBeAg conversion. This is also very, very important point. All right. And another important point that has been asked in the MCQs are genotype C of hepatitis B virus is most associated with cirrhosis and hepatocellular carcinoma. Again, another important point that I want all of you to note down. All right. Want all of you to note down. And D is typically found in Mediterranean basin. Other things you need not know. Just for namesake you need to. All right. Next thing, what are the risk factors? What are the risk factors that leads that just like make sure like a person gets hepatitis B virus. What are the risk factors? First thing is a perinatal exposure, the most dangerous one. If the mother is infected with HBV, the child is more likely to get infected with HBV easily. What is seroconversion? I will tell you. Okay, because this word you will get everywhere. Somebody asked Dr. Jack. Seroconversion. You will get this word across HPV, HCV, and HIV as well. One of the very important diseases. What happens here? A person, for example, having an infection. For example, you take HIV. All right. Today, somebody got affected by HIV. For example, a guy is going to Thailand, Pattaya Island, and he is enjoying himself with everybody there, and he occurs HIV today. What is today? Today is 21/6/24. Today evening, 5 o'clock, like maybe 4 o'clock, Thailand time, he had a great fun, and HIV virus entered in this guy's body. Are you following me? All right. If you go and test him with a rapid test, will he test positive or not? To the doctor who asked the question. Once again, very clear. I hope you understanding the scenario. A guy in Thailand today going and having a great fun. He acquired HIV. Will he test positive or not? No. But is the HIV virus is in his body or not? Yes. Am I right? It is there. As time goes by, you are testing him again on 21/9/24. If you test him, will he now test positive or will he now test negative? He will test positive. So seroconversion is the time interval, okay, between exposure to a virus to formation of antibodies against the virus. All right. This is called a seroconversion. Clear? I hope your doubt is clear. No one should have any doubt about the seroconversion. This seroconversion can be delayed in some individuals who have immunocompromised state. For example, if the same guy who had a misadventure or an adventure with people in Thailand and Pattaya, okay, the same guy is immunocompromised. Maybe he is a renal transplant recipient. He has a renal transplant and he is on mycophenolate mofetil and so many other drugs. He won't be forming the antibodies after 3 months. It may take a long time for his body to generate antibodies because of his suppressed immune system. So there can be delay in seroconversion in such individuals. All right, this is called a seroconversion. You're welcome. Then high-risk sexual behaviors. We have just seen IV drug abuse. Very, very important. And PACES candidates. Anybody is here who is appearing for PACES? Always in the personal history, you have to ask, in case of a male and female, some important things. In case of a male, you have to ask about smoking. You have to ask about drinking alcohol. Then you have to ask about recreational drugs and any casual partners. This 4 domain you have to ask in a man. In a female, along with this domain, you have to ask about 3 Ps. How are their periods? Are they taking any pills to postpone the period or delay the pregnancy? And then were they pregnant before and any pregnancy losses? This is what we call as a triple P. And also in male in personal history, nowadays it's better to include about erectile dysfunction also. All right. So why I'm telling this is, when they say if they are taking a recreational drug or any recreational drug abusers, you have to always think whether they are sharing the needles or not. You have to ask that in a PACES examination. Needle sharing, very, very important. IV drug abusers, especially the ones with IV drug abuse and ones who share needles, are a very high risk factor. It's a very high risk factor for acquiring HBV. Also, blood transfusion is another high risk factor. Solid organ transplantation. healthcare workers, sex workers, history of incarceration, people who are living in, cramped environments like jail. What happens in jail? Why jail has become any jail is becoming a source of conditions like, COVID, that time, so many inmates got affected with COVID. All right. Then also, along with COVID, HIV, HBV, HCV, so many, because inside jail there's a rapid circulation of drugs, and also there is a lot of homosexuality going on. To be honest, that's the truth. A lot of homosexuality going on. So, because of this MSM, men sex with men, these diseases are very high in prison inmates. All right, these diseases are very high in case of a prison inmates. So that is a reason why, this incarceration and all these things should be, people who are incarcerated and all should be very, very careful, because they are very high chance of occurring this. Then household context, family history of hepatitis, and people who are born in the endemic region where the hepatitis chances are very high. So now comes to the investigation. Okay, investigation. How exactly and what are the tests you will be doing here? The first test, I'll explain the things that is needed, is the liver function test. In any viral hepatitis, I'll tell you a couple of things. The ALT, AST value, the liver enzyme value, you can find more than 500 or in thousands. If you're finding something like that, all right, if you're finding something like that, you are encountering a viral hepatitis. Always remember. All right, you are encountering a viral hepatitis. All right, next is your full blood count. You may find anemia or a thrombocytopenia. Urea and electrolytes. Okay, urea and electrolytes, you have to check to rule out any associated hyponatremia and high blood urea. All right, high blood urea, because many a times due to hepatitis, there can be hyponatremia due to volume overload or use of any diuretics in a patient with hepatitis B related cirrhosis. So you have to check urea and electrolyte. Then you have to check coagulation profile, and very, very important, serum hepatitis B surface antigen is something you have to check at any cost. Okay, serum hepatitis B surface antigen is something you have to check at any cost. It will be positive. Then you can check for serum antibody or hepatitis B core antigen. Okay, antibody to hepatitis B core antigen. You have to check both IgM and IgG. If you find IgM, it is an acute infection. If IgG is developed, it is a chronic antigen, chronic infection. Okay, this is something you should be knowing very, very carefully. And here I am going to introduce a term which all of you should know. Is called the term called pre-core mutant. What is a pre-core mutant? It's a variety, it's a mutation in Hep B virus. It will not produce hepatitis E antigen. There won't be HBeAg. There won't be any HBeAg in case of a pre-core mutant, because this has been asked in MRCP MCQ. That's the reason I'm stressing on this. Okay, there won't be any HBeAg. Okay, and any infection caused by this virus with a pre-core mutation are difficult to treat. Okay, they can be difficult to treat. All right, this 2 points you should know. Okay, these viruses are very, very difficult to treat. All right, next, with this we will go to the next set of investigation. You should know serum HBV DNA. If the treatment is done already, it can be undetectable. Otherwise, it will be elevated. Abdominal USG, liver biopsy. Okay, in liver biopsy, it can be normal or there can be necrosis as well. And fibroscan. If you do a fibroscan, that is transient elastography, there will be increased liver stiffness can be found. And serum liver fibrosis biomarkers and as well as alpha fetoprotein is something you have to check. Why alpha fetoprotein? What it signifies? It signifies if it is elevated, there is a higher risk of hepatocellular carcinoma. So these are the investigations you have to do. All right. Now comes to the management. What are the management options for it? Because a lot of you has asked me, they need to know the management, what to do in an acute setting, what to do in a chronic setting, and what to do in case of a pregnancy or in a breastfeeding. Because questions are made on this. No? Questions are made on this. So we need to know in all the settings what are the drugs we are going to give. All right. The very first thing in case of any acute hepatitis B infection, okay, BMJ and NICE says give the supportive treatment plus entecavir or tenofovir. All right, be very, very clear. Supportive plus entecavir or at tenofovir. All right, they are clear. That is what you are going to do in case of acute hepatitis B infection. In case of a chronic hepatitis B infection without cirrhosis or without HbAg and the patient is not pregnant, then again you have to give the same entecavir for tenofovir. You can here add a pegylated interferon alpha 2A. Be very clear, in case of a chronic hepatitis B infection, you can add an entecavir along with entecavir and a tenofovir. You can add a pegylated interferon alpha 2A. In case of a chronic hepatitis B virus in an adult, okay, non-pregnant, but also if there is any cirrhosis, okay, cirrhosis, then you can add all these things. Again, you can add interferon alpha 2A as well in that patient. You can add interferon alpha 2A in that patient. Next, in case of a pregnant and breastfeeding, what is the drug of choice? Because this has been asked recently on MCQ as well. So in pregnancy, the primary drug of choice that is recommended recently, because I made the slide today, I know, I checked the updates, it's tenofovir in UK. All right, tenofovir in UK. Lamivudine is a secondary choice. The primary choice is tenofovir. Please don't make any mistakes here, okay? The primary choice is always going to be tenofovir. Then comes the American guidelines versus the British guidelines. Here there is some slight change. The US recommends go for a C-section in case of a hepatitis B. If the mother is having hepatitis B, she's pregnant, go for C-section. But European guidelines and UK guidelines is kind of ambiguous. It shows a lot of ambiguity in that. It's neither for this nor for that. All right, neither for this and nor for that. That one thing you should know. Then comes to the complication. What are the complications that can arise out of hepatitis B infection? Okay, what are the complications that can arise out of hepatitis B infection? Can lead to fulminant hepatic failure. That is one of the dreaded complications. A fulminant hepatic failure can occur in this. Yes, you can give prophylactic antiviral before delivery. You have to start because already you will be definitely treating the mother, right? Already you will be treating the mother with tenofovir or lamivudine, right? Tenofovir or lamivudine, you will be treating her. And safer side, many centers are doing a C-section for a safer side. Then cirrhosis can occur. Then other dreaded complication is hepatocellular carcinoma. This is why we are going to do alpha fetoprotein levels. And hepatitis B associated glomerulonephritis. There is another entity called cryoglobulinemia, which we will see tomorrow along with Hep C. It is most associated with Hep C than Hep B. Then other complication is reactivation. It can cause reactivation. And there are chances of hepatitis B associated malignancies. All these things can occur as a complication. Then comes to the important part, that is the vaccination. What UK recommends is exactly I copied. I will just dissect and tell you what recommendation we get in UK. First thing in UK, the routine childhood immunization program always includes your hepatitis B in combination with other vaccination. All right. Hepatitis B also it's recommended at the age 8, 12, and 16 weeks and can be given from 6 weeks to 10 years. Number 2, babies born to hepatitis B infected mother should receive monovalent hepatitis B vaccine at birth within 24 hours and at 4 weeks. All right. Please make sure note it down. Any baby born to hepatitis B infected mother should receive monovalent hepatitis B vaccine at birth and at 4 weeks, followed by multivalent vaccine at 8, 12, and 16 weeks. And again tested for HBsAg at 1 year and given a further dose of monovalent hepatitis B vaccine. All right. Then babies born to hepatitis B infected mother should also receive HBIG, hepatitis B immunoglobulin, within 24 hours of birth. Okay, within 24 hours of birth, unless the mother is HBsAg positive and HBe positive and the baby weighs more than 1500 grams. Very, very important points because MCQs has been asked in this. Then from child 1 to 10 years, it different with different groups. For PACE's communication scenario here, I want to add something. Then we will go for a quick quiz of how to interpret hepatitis B and hepatitis C and general hepatitis viral serology. Okay, we will go for a quick quiz. For communication scenario, if any PACES candidates are here, I want to tell you a couple of things. These are the things you need to tell. If suppose the scenario is coming, somebody is diagnosed with hepatitis B. Your task is to go and explain the condition. Go and explain the condition. You have to go and explain the condition. Somebody is diagnosed with hepatitis B, you have to go ahead and explain the condition. You have to explain everything. And in the explanation, these are the things you have to tell them. Have household and sexual contacts vaccinated always if they test negative for HBV serological marker. Always they are advised to use barrier protection during sex if the partner is not vaccinated. Don't share toothbrush, razor, injection equipment, or any glucose testing equipments. Do not donate blood, organs, or semen. Very, very important. And cover open cuts and scratches and clean blood spills with bleach. And vaccinate also against hepatitis A. These are the things you need to tell them at any cost. They will expect you to tell this. Otherwise, your CJ, clinical judgment, will be impaired there. Abstain from or limit alcohol use because it will cause accelerated liver damage. It will cause accelerated liver damage. So abstination must be advised. Now comes the interpretation. A very simple table I'll put. Here is HBsAg. Here is anti-HBC. Here is IgM anti-HBC. Here is anti-HBS. Hope my handwriting is clear, or should I make it more clear? Okay, I'll make it more clear for you. Okay, rather I'll write in caps. HBsAg, anti-HBC, IgM anti-HBC, anti-HBS. What is the interpretation? First, if HBsAg, first scenario, this is negative, this is negative, nothing is here, only anti-HBS is more than or equal to 10 unit per liter. What is the inference? Who is going to answer me? What is it? You are finding no HBsAg, no anti-HBC. Only thing you are finding is anti-HBS. Then it is Dr. Zain has answered. Excellent. That is a vaccination, not recovery. If there is a recovery, there will be antibody will be there. This is a vaccination. And IgG, everything will be there. This is a vaccination. All right. I'll tell you how a past infection that is recovered. Now, next scenario. HBsAg is negative. All right. But anti-HBC is positive. All right. Anti-HBC is positive. And anti-HBS antibody is more than 10 per liter. Now, this is. No, this is not immunization. In immunization, please be very clear. You will find only anti-HBS, nothing else. All of you, because I know this will be confusing. That's why I wanted to take this table in a handwritten manner rather than I would have easily copied and pasted a table and blabbered something and went. I don't want to do that. I want all of you to be attentive. Be very, very clear with me. Listen to me. In case of vaccination, you will just find anti-HBS and nothing else. Write it down. Right? If you find anti-HBS and anti-HBC, it says nothing other than past or resolved infection. All right? Past or resolved infection. Number 3, HBS AG is positive. Okay? Anti-HBS HBC is positive and IgM is positive. What is it? And what is it called? Anybody? What is it called? Excellent. This is an acute infection. No doubt in that. All of you should be very clear. This is an acute infection. All right. Now, in case of IgM, if IgG is positive, this is positive, this is positive, then it is a what? It is what? Excellent. That's it. That's a chronic infection. If you know this much, this is more than enough for you to survive any questions going to be asked from hepatitis B. Any question that is going to be asked from hepatitis B, you will survive. If you know this much, this is more than enough. And interpretation, risk factors, genotypes, what is the virus, what are the peculiarities of the virus. All right. This much, if you know, this is more than enough. You will 100%, you will go through this questions and answers that is coming on hepatitis B. All right. Tomorrow we will see Hep C. Then another day, malaria. And please leave your topics which you guys find very difficult to interpret, difficult to do. We from MedExpert are more than happy to come here for you during our free sessions. This short 20-30 minute session, we are more than happy to come here and we are more than happy to explain you in the best possible way, in a way that you will understand. It's very easy to teach people who are top-notch, the toppers and the scholars. But you want to see the vaccination slide once? Yeah, please go ahead. This is the vaccination slide one. All right. Please see that. It's very easy to teach toppers, but it's very tough to teach people who don't have basic understanding. And we are carrying out the process of doing it because we want everyone to come on top and do the best in their examination. So this is another free session from us. Please leave your valuable feedbacks and please leave the topics which you find it difficult, because so far we got only questions on like hepatitis B and C. Doctor, please leave it in the group. It will be very easy for us to organize sessions for you all. Okay. In ALL, CML and CM, ALL, CLL, AML and CML. All right. Not a problem. Not an issue at all. We will definitely do. All right. Please leave your feedbacks in the group. This is another short session. Tomorrow, I will try my best to take one more session for you all. All right. Okay. Definitely. Please leave this feedback and the questions which you need in the group, in the WhatsApp group and not here, because then only we will keep it in a, we can easily, it will be easy for us to note down. Please leave there. All right. Thank you so much. And I'll see you again tomorrow with another session. All right. Bye-bye. See you guys.